I'm doing okay.
I'm going to listen to your heart or listen to your lungs today.
Oh, okay.
So, are you having any problems breathing today?
No.
All right. So, I'm going to kind of explain what I'm doing while I'm doing it, okay? So first of all, what I'm going to be looking for is I'm going to be watching you, and I'm going to be talking to you, and I'm going to be noting respiratory distress. So I'm going to take the mask off also so I can talk to the people I'm recording for. So if I was noting respiratory distress, I would notice how many words she can say in a sentence. So you're not having any respiratory distress. Have you ever had respiratory distress before?
Not that I can remember.
And you don't have asthma?
No.
Okay. So let's talk about what you like to do. Do you like to garden?
Actually, I do.
Okay. What kind of things do you like to garden with?
Well, in my house, behind my house, I have a little pond.
Mm-hmm.
It's not big, but I like to garden around it and do plants in pots.
Okay. So I noticed that she can talk to me in about 10-word sentences and with no shortness of breath. And so while I was watching her, I'm also watching how many breaths per minute she's having. And so for me, I usually do about 15 seconds. And so she's breathing about 18 breaths per minute. And I don't hear any audible signs of breathing, so I don't hear any wheezing, and I don't hear any hoarse breath sounds. And so I'm also looking at her, and I'm noticing if she has any accessory muscles. And so when you notice accessory muscles, you notice if they're you see any bulging of the muscles between the intercostals or up here near her scapula. Her breaths, I see that her chest is moving symmetrical, and so I'm basically just watching for that. Sometimes if people come in and they've had car wrecks or they have pneumothoraxes, you will see that sometimes they might have unequal expansion of their lungs. And I'm also looking at the shape of her chest. People with COPD may have a chest where they're this diameter and this diameter are larger, and they may have what we call a barrel chest. So now I'm going to look back here, and I wouldn't necessarily raise the shirt up, but I'm going to look and see if I noticed any retractions of that. And what that is, is the rib cage moving inward. And sometimes you'll see that with kids that are having asthma attacks. Okay, so now I'm going to palpate, and like I said, I'm going to palpate anteriorly and posteriorly on the lung fields, and I'm going to ask her, all right, is any of this hurting when I'm doing this? Okay, and I'm kind of going on the intercostal spaces. Okay, so again, intercostal spaces. Okay, no tenderness. And I don't see any bruising anywhere, and that's really important. Like if you have a person come in that's been in a car wreck, you want to make sure you look and see. A lot of times you'll see a seatbelt bruise, and that can be, they can have a damage in there, and then you want to document where that is. Okay, so I'm going to feel on her chest, and I'm going to just put my hands on her chest in the back, and I'm going to have her say 99.
99.
And you're going to be feeling to see if there's tactile fremitus.
99. 99. 99.
Okay, and I don't feel any tactile fremitus. I don't feel anything. Okay, so now, would you mind turning to the side? I would not have a patient do this, but I'm going to have her do this for the purposes of this exam. And so I'm going to place my fingers about at the 10th rib, and I'm going to have her take a deep breath, and I'm going to see if, okay, let it out, and then I'm going to have her do it again. And so you notice that both of my hands rise at the same time. Okay, so the expansion was the same. Okay, you can turn back to around, thank you. Now, I'm going to percuss. So I'm going to raise her shirt again. Percussion, you would use the finger, and then first finger is going to be straight, second finger is going to be like a hammer, okay? And I'm going to percuss to see if I hear any dullness. And if I heard that, there might be fluid in her lungs, but I don't hear anything. So now what I'm going to do is I'm going to percuss up till the sound changes. Sound changed right about there. And I'm not going to actually mark on her skin, but I might mark, if I'm doing this test that I suspect somebody has fluid in their lungs, I would mark, and then I would have her take a deep breath. Take a deep breath for me. And then I would continue to percuss up. And so about this much, okay, you can breathe now. About this much, there was this much difference from when I percussed when she was just breathing normally, and then I noticed when she took a deep breath where the sound changed. Okay? And that is called diaphragmatic excursion. Okay, so now I'm going to listen to her breath sounds, and you want to do this in a ladder-like pattern. So I usually listen at the top first, okay? And I have people, I breathe with the patient because you can make people get very lightheaded. So take a deep breath for me, in and out through your mouth. Another one, good. Okay, could you mind raising your arm on this side and let me listen on this side? Remember, you have 3 lobes on your right lung. And that is clear. Okay, now I'm going to listen anteriorly, and I'm going to listen for tracheobronchial and vesicular breath sounds. Okay, and her breath sounds were all within normal limits. I didn't hear any rhonchi, I didn't hear any wheezes. And now I'm going to listen for transmitted voice sounds. And so I'm going to listen again in the back. And I'm going to have her say E. Say E, okay?
E, 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 E.
Okay, so if somebody has egophony, the E would sound like an A. And if I'm going to have her say 99.
99, 99, 99, 99, 99.
Okay, and those all sounded like 99, so that is normal. Okay, so if you have, that concludes the assessment of the lungs. Thank you.